Hello, I'm Sonia Tanaka. I'm the Director of Programs and Innovation at Global 50/50, and I'm going to give you a guided tour of Gendered Health Pathways, our groundbreaking data visualization tool. This tool is a first in combining several standardized global data sources to create a clear, connected picture of the difference in men's and women's journeys with HIV, diabetes, and hypertension around the world, from exposure to risks through to diagnosis, treatment, and mortality. So in this video, we'll show you how to use the gendered health pathways to 1, identify where there are data gaps globally, 2, compare country-level data on men and women's journeys across the health pathway for 3 of the world's deadliest conditions, and 3, identify inequities in the health pathway and read about gender-responsive interventions. So on our homepage here, you'll find a short video that will take you through the concept of the tool and how it can be applied to understanding health inequities. And you'll also find a series of stories that bring to life the data by following women and men along the health pathway and explore the kinds of risks to their health that they may face. So let's take a look at the global map. This shows all countries where sex disaggregated pathway data was available in global data sets for these 3 conditions. And using the key on the right, you can see where data is available for 1, 2, or 3 conditions for each country. Now, if we select a country and we click through to see the country view, like this is going to bring up the gendered health pathway. At the top of these country pages, we can see some key prevalence statistics on that specific condition, hypertension in this case. And along the bar here, we can see where we can select for age range, country, and condition. Our health pathway starts on the left here, where we've got the sex disaggregated data for the top risk factors for each condition. In Algeria, we can see, for example, that 62% of women are overweight compared to 49% of men. Women are also more likely to be obese, 37% women compared to 18% men. We also see a major difference in smoking rates between men and women in Algeria, with 32% of men smoking as compared to 1% of women. We move along the pathway to the next step, prevalence, where we see that the prevalence of hypertension among women and men in Algeria is quite similar. Once we're inside of the health system, we start to see some more pronounced differences. Women with hypertension are more likely to be diagnosed, they're more likely to be treated, and they're more likely to have their hypertension controlled than men. And finally, we see the outcomes of mortality is also different among women and men. For 100 hypertension-related deaths among men, there are 94 among women. Each of these data sets may be drawn from different data sources, and you can explore those sources at the bottom of each step in the pathway. And now that we've looked at the data, you may wonder what kind of gender-responsive interventions could work in responding to those inequalities. If we click here along the bottom of the page, you can find where we've gathered insights from studies, reviews, and health programming that have delivered results by taking gender norms and disparities into account. You can explore the literature by selecting any one of these 3 boxes. Finally, we have an FAQ section on the website under About here, with a whole list of questions as to how to use the tool and how to apply the findings. You can further read about our methods in detail as to how we constructed this tool. So thanks so much for watching this walkthrough, and we hope you now feel ready to explore the insights that sex disaggregated data can reveal.